So let's now talk about a very big topic, transgenderism.
Okay, well, where do we begin?
Can a person change his sex?
An easy question to start with. I'm not the first person to say this. Many people have said it, but you know that we've reached a very crazy place when the same people who say that sexual attraction is fixed and unchangeable, they say that gender is fluid, and now it's even gotten to the point where they're saying that sex is socially constructed and fluid.
And they say these things with a straight face.
Yeah, look, people really think they can subvert reality, that they can alter the physical laws of the universe. It's like that scene from The Matrix where the kid can bend a spoon with his mind.
But it's simple biology, isn't it? Male and female?
Yeah, of course. I mean, go and talk to any biologist who studies mammal species. It is clear-cut. It's what kids are taught in high school biology. Sex is determined by chromosomes, it's binary, and it's expressed most obviously in the anatomy and function of the reproductive system. Talk to a livestock farmer, a dog breeder, or someone who looks after the elephants at the zoo. An animal's born, you have a look at what kind of parts it has. None of these assigned male at birth nonsense. Sex isn't assigned. It's a fact of biology.
The activists, though, they point to the rare conditions always, don't they?
They're conditions, tragic abnormalities where something's gone wrong. And they're extraordinarily rare. Something that we were taught in medical school was that some of these intersex conditions are deadly emergencies. The baby can die within hours. Their hormones are so messed up unless you give them urgent treatment. You don't define normality based on rare disorders. It'd be like studying the eyes of blind people to derive your understanding of human vision.
Right, and now I imagine having a proper understanding of sex is fundamental to medicine.
Yes, definitely. So much hangs on whether the patient in front of you is male or female. It's one of the first details that you need to ascertain when you start treating somebody. If you get it wrong, you could end up making some very bad mistakes.
Can you elaborate on that?
Well, your sex affects your health in so many ways. Your risk of heart disease, your risk of various types of cancer, the chances that you might develop something like rheumatoid arthritis or a thyroid problem. There are big, significant differences between the sexes. Men and women can experience heart attacks differently. There are just so many differences, and that's before you even get to the reproductive differences. When you've got somebody in front of you with a set of symptoms and you're trying to figure out what's wrong with them, their sex, whether they're a man or a woman, it's something that you've always got to be mindful of if you want to get the right answer. When you order a test, there are differences in what is normal. For example, what's considered a normal number of blood cells is different in men and women. The lab which counts the red cells needs to know if it's looking at male blood or female blood. And the same goes with kidney function, lung function, bone density, and lots of other things.
And then there are the sexual differences.
Right. And that's why you have the concept of men's health and women's health. Here's the textbook that taught me how to be a doctor. Part 5, women's health. Part 6, men's health. I'm always amused by the way that the women's health section is 3 times longer than the men's health section.
Well, we know that women are a lot more complicated than men, don't we?
Yeah, they certainly are. Now, this new ideology, this gender ideology, which says that sex isn't fixed, it's malleable, it's just a social construct, something that we assign to babies.
When you say it's an ideology, what do you actually mean by that?
It isn't scientific. It has no biological basis, not a shred of it. You've got to look at the fact that they're claiming now that there's 71 or 73 different genders now. It's off the scale moon battery.
When a child is born, they are identified and observed in a particular sex,
The child is born without sex, and the child is formed without sex in the beginning.
So this ideology, if you actually took it seriously, it'd make a complete mess of the practice of medicine. You'd have to tear out those sections out of the textbook, men's health and women's health. It wouldn't make sense anymore. Maybe you'd have to change it to assigned male at birth health or assigned female at birth health or something like that. All this talk out there now of men having periods, pregnant men, it's just ludicrous. But, there's a side of it that isn't funny at all. It can be extremely dangerous.
How so? Dangerous?
Deadly dangerous. So just last year, there was a case described in the New England Journal of Medicine, and it was reported in the media. A woman who identifies as a transgender man, she went to a hospital, this was in America, and she was in labour. But because she presented as a man, and the doctors and nurses thought she was a man, they didn't consider the fact that she was pregnant. So they fluffed around trying to figure out why she was in so much pain, and the baby died.
It's certainly a tragedy when things like that happen.
It's horrible. It shows that you can't just screw around with these biological definitions, biological facts, and expect healthcare to remain safe. Also, last year in the UK, alarm bells were rung about people missing out on life-saving cancer tests because they identified as the wrong sex. If you're a biological woman, but you're registered as a man with the health system, so you don't get tested for female cancers. There's very real harm that happens when you start working based on ideology rather than facts.
Not to mention all the other effects this is happening on society, such as biological men competing in women's sports.
Yeah, look, it is completely ridiculous. Even Martina Navratilova, she thinks it's unfair. When you have a huge 7-foot muscular guy playing footy against women, it's not fair, it's not safe for the actual women playing the game.
Do you think the general public are duped by any of this?
I'm pretty sure, Mark, that the average person in the street isn't convinced. It is just so patently absurd. It flies against all common sense. This whole thing has just swept into our society in just a few years. The ideology is being inflicted on our children through things like the gender unicorn, drag queen story times, safe schools. I think it's exactly like the story of the Emperor's New Clothes. Everyone can see that it's not true. It's a total con, but they all keep their mouths shut and they play along because they have to. They don't want to be the one that speaks the obvious and then has the whole mob come down on them.
They might lose their job or be deregistered.
Yeah.
Now tell me what you think about the dramatic increase in children having sex changes.
Yeah, look, it's tragic, simply awful. It's a tsunami, that's not an exaggeration. In the UK, the number of kids going for gender reassignment treatment has increased by 4,000% over the last 10 years. The same explosions happen here in Australia. It's a order of magnitude increase.
Does this suggest that there are societal factors at play?
Definitely. A lot has been written about this. It's been described by some experts as a fad. The phrase that gets frequently used now is social contagion. You see this especially in the phenomenon that's called Rapid Onset Gender Dysphoria, or ROGD.
What's that?
It's where teenagers, adolescents, suddenly declare themselves as transgender. But before that, when they were younger kids, there'd been no sign at all that they were uncomfortable with their biological sex. This is a phenomenon that's been observed. It's been documented in the last couple of years. A researcher by the name of Lisa Littman, she's a gynecologist and public health expert, she started the ball rolling on this.
I guess she lost her job.
She did, actually. She'd committed blasphemy. Anyway, there's a disproportionate number of girls who experience ROGD. This is what's been observed. And it's been observed that these girls were spending a lot of time on internet chat rooms before going on to declare that they were actually boys. So that's where you see the social contagion at play.
Kids can be impressionable at that age.
Yeah, they can. For adolescent girls, body image issues are a common thing. Suddenly you're growing breasts and having periods. These can be uncomfortable changes. And so then you go online and you find a whole community of people talking about about transgenderism, and they convince you that you'd be better off as a boy. There's other things that have been observed too. For example, there's a disproportionate number of autistic kids starting to identify as transgender.
And these children that are confused about their gender, what actually happens to them?
Well, sadly, many of them now are sent to gender clinics and they're put on puberty blockers. These are incredibly powerful hormones which disrupt the function of your pituitary gland. That's a gland inside your brain. I've injected these drugs into old guys who have prostate cancer. But in kids, it stops their bodies going through puberty.
Well, that sounds very invasive. It can't be healthy to stop a body's natural development like that.
Yeah, there are some very serious safety concerns. There's a group of endocrinologists, hormone specialists, who've spoken up about this. Michael Laidlaw, he's one of them. In fact, his most recent article was January this year. These are very powerful drugs. There are side effects, there are safety concerns. They don't just stop your reproductive organs from developing, they also disrupt the growth of your bones and your brain development.
Well, this is all very disturbing.
Something else that's disturbing is that we know that around 8 out of 10 kids with gender dysphoria, if they're just left alone, given psychological care and emotional support, not pumped full of hormones, they'll grow out of their dysphoria with time. They'll come to accept the body that they were born with. But the statistics show that with the kids who are put on puberty blockers, virtually all of them continue to believe that they should be the opposite sex. And then they continue on to the next stage of hormone treatment.
So these drugs, they're like a self-fulfilling prophecy.
Exactly right. Once you're put on them, once you start down that path, it seals your fate. These drugs are not neutral. They actually alter, determine the outcome for most of these kids, up to 80% of them.
For the rest of their lives?
For the rest of their lives, which brings us to the issue of consent. You know, how can an 11, 12, 13-year-old kid consent to this kind of drastic, long-lasting chemical alteration of their bodies? You know, they're going to be rendered sterile, permanently dependent on synthetic hormones, permanently dependent on doctors and the health system. You know, I've got this medical article here, which discusses the vexed problem of whether children can give consent to medical treatment. It's about prescribing antidepressants to kids. You know, doctors, we agonise over whether a kid can understand the pros and cons of being put on antidepressant medication, whether they're mature enough to make that kind of decision. But here they are at these gender clinics letting kids who are barely into their teens, you know, sometimes they're still in primary school, make decisions about these unproven treatments that will radically alter their bodies, their brains and their lives.
Do you think there's a huge amount of inconsistency here? We don't let kids vote, we don't let kids drive a car, we don't let kids buy alcohol, we don't let kids sign a contract until they're 18. Yeah,
or consent to sex unless it's with someone the same age as them. But we let them make these decisions that will lead to permanent and, in most cases, irreversible changes to their bodies.
It's mind-boggling.
Sure is. Yeah, I think this is why the gender activists need to get their hands on these kids. You know, get them transitioning when they're still young. If they wait till they're 18, they'll have lost 80% of them, and they don't want that.
What about the argument they make that if you don't let kids transition their gender, that they'll kill themselves?
Look, if you look at the actual evidence, you know, first of all, these puberty blocking drugs, they're known to cause mental health side effects, serious ones. Going back to that recent article by Dr. Michael Laidlaw, the side effects of puberty blockers include emotional lability, mood changes, anxiety, agitation, confusion, delusions, insomnia, depression. Okay, so this idea that we've got to let children transition for the sake of their mental health, it involves giving them powerful drugs that may very well stuff up their mental health even more.
That doesn't make any sense.
No. Some recent findings out of the UK from about mid-2019 actually suggests that the hormone treatments may increase suicidal feelings in children. This was reported in the BBC. And then there's the well-known Swedish study looking at long-term outcomes after people have medically transitioned their gender. And what it found was that when you look 10 years or more down the track, these folk who've had the treatment have a suicide rate that's 20 times higher than everybody else.
20 times higher.
It's horrible. And it just shows how misguided it is to think that providing these so-called treatments is helping people, that it's helping them achieve better mental health in the long run. You know, there's this myth that people have, I think, that doctors know what they're doing with all this stuff. But it's a myth. Honest doctors, like, for instance, Professor John Whitehall, he's a paediatrics professor up in Sydney. People like him have admitted that it's all an experiment. It's all unproven. None of this stuff has been properly studied. We don't know the long-term safety of it, and we know that there are some serious risks.
So we're experimenting on children.
Exactly. We're treating them like lab rats. And adults too. You know, even if someone's 18 and over, we shouldn't be giving them hormones to mimic the opposite sex. It's unethical. It's medically unsound. Take a look at this. This is from the TGA, which licenses all the medicines that we're allowed to use in Australia. Look at what these documents say about testosterone. Must not be used in women. Okay? That's the companies who manufacture the hormone and the TGA saying that testosterone is not for women. It hasn't been tested in women. We don't know it's safe. But that's exactly what they're doing with these so-called transgender men, giving them regular doses of synthetic testosterone lifelong. They're going against clear recommendations, which are there for safety reasons.
And what about giving female hormones to men?
I couldn't find the same stark warnings at the TGA, but I think that's because nobody in their right mind would dream of giving estrogen pills to men, at least until now. You know, estrogen pills are meant for women as contraception. They can actually be quite unsafe. You know, they can cause blood clots in the lungs. They can cause strokes. I've actually seen these things happen. You've got to be very careful with these things. And if something does happen, you can't expect to go to the company that made the pills and ask for compensation. They'll say, we didn't make this for blokes. We haven't tested it on blokes. You've done that at your own risk.
It sounds like prescribing hormones is not something to be taken lightly, not when it's going to be for the next 30, 40 or even 50 years.
Let me show you something else. This is a recent story of a doctor who prescribed testosterone to a man 8 times. The man, he was unhappy about his body. He wanted to look more like that. Now, what they said was that by giving testosterone to this guy, the doctor had exposed him to, quote, a risk of serious side effects and harm. Okay, so you have a guy who's distressed about his body image. A doctor gives him testosterone, you know, gives male hormones to a man 8 times. And the doctor's reprimanded for putting the guy at serious health risk. Now, in these gender clinics, you have young women, adolescent girls, who are distressed about their body image, and they are put on testosterone, male hormone, which is not physiologically appropriate for them. It's untested against the manufacturer's warnings, and they're put on it for the rest of their lives, and that's considered okay. Do you see how crazy this is?
Okay, so you would say there's potentially some very dangerous experimental treatments being tried out on children. Permanent life-altering treatments.
Right.
And it's based on ideology. It's a fad. It's societal driven. It's something that doesn't have any biological or scientific basis.
Yeah, correct.
So why aren't more people protesting this?
Well, on the one hand, the trans lobby are extremely vicious. You know, they'll brutally attack anybody who dares to suggest that there's something wrong with any of this. Like they attacked Lisa Littman. Look at how they went totally nuts at Germaine Greer, feminist icon, because she's opposed to it. They came down like a ton of bricks on Martina Navratilova. Just recently, J.K. Rowling, Harry Potter author, she said she doesn't believe in it, and the mob went totally feral at her.
Dissent will not be tolerated. It's hard to protest something when you know you're going to be shouted down or deplatformed or potentially even lose your job.
John Whitehall, the paediatrics professor who's been vocal about this, he's written that he's talked to a lot of his medical colleagues and they've told him quietly that they agree with him, it's all a load of rubbish. But they've also told him, don't expect us to take your side in public. You're on your own out there.
So people have been intimidated and bullied into silence.
They have, but not completely. There are a lot of professionals, legal experts, doctors and nurses, psychiatrists, who have bravely stood up and said that this stuff is wrong. In the UK, a group of clinicians quit the big gender clinic there last year, and they spoke out in protest. Many medical specialists have written and spoken against it. Paediatricians, psychiatrists, those endocrinologists who I mentioned earlier. A group of several hundred child health specialists in the USA have come out strongly saying that we shouldn't be messing with children's bodies in this way. It's unsafe, it's scientifically unsound. A professor of child psychiatry in Sweden, Christopher Gillberg, he recently said that what we're doing with these children is, quote, one of the biggest scandals in medical history. A top psychiatry professor in the US has described it as a temporary craze, back like when doctors did lobotomies. Some medicos have called it child abuse.
So there is some pushback happening.
Yeah. Here in Australia last year, a group of doctors put together a petition to the government raising all of these concerns about what's being done with these gender-confused children. It gathered more than 250 signatures in 3 days. 250 Australian doctors, including child health specialists and psychiatrists. After 3 days, it had to be shut down because the website got attacked by trolls. If you read the Australian newspaper, they've just recently done a whole series of articles about this topic, exposing the scandal, giving voice to the various kinds of experts who are critical of it.
And it's not just the experts, is it? It's ordinary people, mums and dads, people with common sense who are very much opposed to this.
Of course, yes. Again, it's the emperor's new clothes. If you go outside the elite woke bubble, talk to the average guy at the pub, he doesn't buy it. There's community organisations that have formed to push back against the gender nonsense. Here in Australia, we've got the Binary organisation. They're a great one to follow. In the US, there's a number of groups such as the Kelsey Coalition. Mums and dads who don't want this foolish and dangerous ideology pushed on their kids in schools. And it isn't just old-fashioned folk, it's even the feminist groups.
Well, that's right. All of this must be very troubling for the Germaine Greers out there.
Yeah. Right. They've spent so long fighting for women's rights, and now you're having men, guys with male genitals and deep voices, calling themselves women, beating women in sport, winning women's awards, getting into women's spaces and so on. This
madness can't go on, can it?
I don't think it will. I think it'll all fall apart. Give it 10, maybe 20 years. The problem, though, is the number of young lives which will be damaged irreversibly before that happens.
So what do you think about the doctors who carry out these, quote, gender change, unquote, treatments?
Some of them will have drunk the Kool-Aid, they believe the ideology, and that's why they do it. Look, I think many of them, and perhaps most of them, are well-intentioned. They think they're helping. But good intentions aren't enough. Let's say a drug addict comes, he asks me for a big morphine prescription, he needs it for his addiction, and I feel sorry for him. I want to help him, so I give him the morphine. I'm well-meaning, but I've done something really wrong. I've done something harmful to that patient.
So the road to hell is paved with good intentions.
That's right. Medicos, we're supposed to base our practice on good ethics, on sound science, on hard biology, not ideology. We're supposed to be cautious, the principle of first doing no harm. It just isn't good enough to say that I meant well. That is no excuse. History isn't going to look back on you kindly. Remember, we're talking here about destroying normal bodily functions. chopping off healthy body parts. One doctor who's written about this topic, he calls it an abuse of professional privilege. It's taking healthy people and pathologizing them, making them sick.
Certainly in the future, if and when this all goes pear-shaped, the patients aren't going to be thanking these doctors, are they?
No. This is something that's been documented. There's an increasing number of people who are regretting it. Detransitioners, they're called. They went through the hormones. In some cases, they had surgery to their breasts and genitals, healthy organs mutilated, disfigured by unnecessary surgery. And then 5-10 years down the track, they're now in their 20s or 30s, and they don't want to do this anymore. They realise that they've been misled. They want to go back to living as the gender that corresponds to their biology. Does anyone actually think about what it might really be like to try and live long term as the sex that you aren't? How are you supposed to have relationships? How are you supposed to have a family? You remember, these treatments cause sterility, and the drugs with all their side effects are lifelong.
It's setting up these people for a lifetime of unnecessary suffering, isn't it?
Yeah, that's right. These young people who are confused, what they need is empathy, good psychological care to help them accept themselves the way they are, not a lifetime of medicalisation.
So was it worth it? Was it worth having your livelihood and your job taken away from you?
I'm not pleased about that, but truth matters. The stuff that we're talking about, it's people's well-being, it's the well-being of society. These things are critically important, and the threats that our society faces from this idiotic ideology of gender deconstruction, gender fluidity, are immense. We are the first society in human history stupid enough to think that we can tamper with the fundamentals of our own existence. And the price that we'll pay, the price that our children will pay, will be very high. So people might get aggro when you point these things out, but you'll never hear them respond coherently to any of the facts that we've gone through. They simply can't. This is an utterly nonsensical 5-year-old ideology versus hundreds of years of solid science and medicine.
Are you hoping that more people in nursing and healthcare will take a stand against this radical gender ideology?
I hope so. I think it'll take courage. It's the kind of thing that will cost you something, clearly. But history tells us that widespread abuses don't stop unless enough brave people speak up. And look, it isn't just people in health. Everybody needs to speak up. People in the education system, people in law, anybody who has a daughter who plays sport.
You're saying that people should speak up even if there's a risk of backlash.
Here's one way to look at it. I think that when you get a ferocious reaction out of people, it indicates that you've found their weak spot. They wouldn't be so determined to shut down opposing views if their own view about these things was able to withstand a bit of criticism. It's a big house of cards waiting to topple down. Everyone who comes along and gives a little push, Margaret Court, Germaine Greer, J.K. Rowling, it's all a genuine threat to their ideology. So I say, don't be afraid of the outrage and the hysterics. It's a sign of desperation. We know they're vulnerable here, so keep on pushing at it. And as you do so, just keep thinking of those thousands of poor children who are being pumped full of hormones. You're doing it for them.
Well, thanks for your time again. Let's hope we can do another one of these again soon.
Sure.